Hello, Jenny, again from America. I have another unindicted baby that I've been having on my list to do, and I finally got around to it. It just seems like I have a lot in my stack here to do. I'm going through the unindicted babies as we speak. Basically, what I'm going to do is I'm going to explain to you. I'm wondering if I found another baby D. Okay. Baby D, if we can recall, that was the one that died due to the fact that the mother did not have antibiotics and her water had broken for 60 hours. That baby had pneumonia prior to delivery. And I think I found another one that had a pneumonia prior to delivery. This was in January of 2016. And again, I'm wondering if this was not, Lucy was not indicted to protect the obstetrics area too, for a second one too. Now this is a twin. It was basically born with congenital pneumonia. And let's read here. It's a severe, often fatal lung infection acquired in utero or during birth, frequently caused by group B strep or E. coli. That's the normal flora. It triggers strong inflammatory response, which this baby had, manifesting in respiratory distress, fever, and sepsis-like symptoms, often requiring prompt antibiotics. So, and basically, just so you know, in this premature babies, their inflammatory response, their immune systems are very underdeveloped. There are two parts to the immune system. It's the first part that looks at the infection and fights it. And then there's a second part that says, whoa, we're going to pull back because you are putting out too many poisons. All right, because the body has to put out the poisons to fight the whatever that pathogen is. And again, there is a part in your immune system that says, whoa, you're throwing too much. You only need to throw out a grenade, and you're throwing out a flamethrower, if you get my drift. And this baby has something called an inflammatory response, what they call I'll explain it. A strong inflammatory response. Again, it is. Let's go through the information here. Here we go. That's what's in pink. Watch that. It was Meg B on that leaked document that was sent to us on Christmas Eve. January 16th, time of death, that is 4 p.m. And it says congenital pneumonia with inflammatory response syndrome. That's what I just explained. Baby was already infected prior to delivery. So question is, do we have another baby D here? All right, now let's look at this page here. These are some of the things that Brewery had put out. Again, this is date of birth. We don't know when this baby was born, but it was a 30-weeker out of 40. This was a twin. All right. Okay, now look at the time of death, 4 o'clock. But what it did was it collapsed at 8 o'clock, and this is why Lucy wasn't indicted on this, because Lucy, although Lucy was on days, you can see that right here. Lucy, if she was days, she would have come in, her shift was 8 a.m. to 8 p.m. Now, granted, the nurses do come in at 7:30 just to get a little head start on the thing, but she would have not been able to even touch this baby until 8 o'clock. And this was the first collapse. So I'll show you the start of it. The start of all the problems started on night shift prior to. All right. And a question I have for all of you, if someone would do this for me. Remember the Dr. A, that registrar? Do we know when he started? He followed Huckness left, and he was the registrar that replaced him. Does anyone know when that date was? Was he the registrar involved in this? I do not know. So here is, again, another thing that Brewery did. Again, somehow it ended up putting on the 15th. It was some sort of a mistake. It's actually the 16th. Now, they're awaiting a postmortem, probable prematurity with sepsis. Mom was a type 2 diabetic, which definitely would have made her more susceptible to so many issues when it comes to delivery. What is a type 2 diabetic mom? And this is, oh my God. Oh, a type 2 diabetic mom with twins, 30-week gestation, right here. That is the blood flow in the umbilical cord is off. Why is this mom delivering now? Delayed cord clamping. Again, delayed cord clamping, there was a reason for it, but as we have found out, and the Countess of Chester, when they don't keep these babies warm. So if you're going to delay cord clamping, they do that in premature babies to avoid a brain bleed later on. But if you do it, you got to make sure you keep them warm. So it was intubated in the NICU. It was given that surfactant. Now the umbilical catheter was in a high position. I do not know if it was in a too high of a position. That is the catheter they put in through the umbilical cord, and there's a low position and a high position. Again, was it put too high? I don't know. But obviously, again, they're saying it was not pulled back. Raise lactate, that is a marker for infection, and increase oxygen requirement and ventilation pressures. Again, ventilation pressures, did they give too much pressure? We do know several instances of several babies, and again, with Dr. A, that registrar, he put baby O on too high of a pressure. Chest x-ray review sticker not used. That's odd. Usually when you review a chest x-ray, there's a sticker that you take off it and you put it in the medical records, and then you can just fill in some stuff. Why was that not used? Now that could be, it could have been purposely not used, or it just could have been they were just too busy. Antibiotic changed on advice from Liverpool Women's Hospital consultant, and then again on advice from Arrow Park Hospital consultant. Why are they having to call two different places? And again, why do their antibiotics not align with Liverpool and Arrow Park? Again, everyone should be on the same plan, the same protocol so far as antibiotics are concerned. My concern is, does the Countess of Chester, they have not updated their antibiotic protocol. Arrest on day, whatever. It's similar to time twin brother who was transferred to the NICU at Arrow Park Hospital, discussed the possibility of having, this is a CPAP. This is a non-invasive, think of a nasal or on a mask. They don't put the tube down the baby's throat, but they can still deliver some pressures to them on resuscitator in delivery room. Again, in the delivery room, is their equipment up to snuff? Are they still using crap, old equipment? Again, if they are going to have a diabetic mom with twins that have blood flow issues in the umbilical cord, a small baby, only 1,500 grams, why don't they have updated delivery room resuscitative equipment? Again, delayed cord clamping, revised UVC guiding regarding position. So that's telling me right now that the umbilical cord catheter was probably not in the same thing. Again, they're waiting postmortem results, and antibiotic policy discussed at network level. Question, aligned with Arrow Park. Oh, geez. Again, another report I'm finding here, and this is the same baby. And okay, it collapsed on, of course, a Friday. At 8 o'clock, but it died at 4 p.m. on a Friday. These people are known. Interesting. This was not Dr. A. Now you do not have to answer that question about Dr. A. It was Harkness, who has been involved in so many instances. Oh, God. Maybe they didn't. I can't. Again, that was involved with baby A, baby E, and I forgot the other ones too. Now, 2 o'clock in the morning, registered for increased oxygen requirement, 21% to 58% on event. ET2 pulled back. Was it half a centimeter? I don't know if that's correct or not. But again, was this a guy that did not put the sticker on the medical thing for the chest x-ray? Was it not deliberately pulled back? Dr. Harkness, you have screwed up in the past on intubating and screwed up on lines. Are you screwing back on this? Morphine increased. I don't believe Dr. Harkness is safe enough to administer morphine to these babies. I don't believe that he has the wherewithal or the knowledge or the skill to correctly calculate the amount of morphine these babies would need. Now we're saying improved chest and thing, vent rate increased over rest of evening, 30 to 50 a minute. No other entry from, okay, he has an entry at 2 o'clock. And again, Dr. Harkness is not doing another entry until 9 a.m. when a baby had the profound desat and bradycardia. Twin was sick as well at the same time, also requiring an intensive care. Observation and increased O2 requirements acted on appropriately over evening. I'm calling bullshit. In retrospect, second line antibiotics might have been started on that night shift by Harkness. He did not do it. I'm assuming he only had the baby on probably ampicillin and gentamicin, which would have covered the mom's flora, the normal flora, which would be E. coli or group B strep. I delivered a septic baby, and she had group E strep. She got it from my flora. She responded beautifully to ampicillin and gentamicin. So that is telling me something right here, that maybe that baby was exposed to a pathogen that was not part of the mom's normal flora. Pathogen that could have been in the sewage that was constantly happening in what? The maternity area. Okay? Again, why did they send, in the initial things that the consultant sent over to the initial, let's look at the pink here, the red here. Why did they send this baby over and they did not send baby K over? Again, 30-week gestation twin. Other twin also deteriorated and required transfer to Arrow Park Hospital. Sudden desat on day 3, unsuccessful resuscitation, postmortem cause for death given as congenital pneumonia, meaning born with it, with fetal inflammatory response syndrome. That kicked in before the baby was born. Now let's look at Dowie's response. Let's look at it here in this red. He's saying not suspicious. Well, not suspicious. Does he say not suspicious because he knows that Lucy wasn't there in the overnight shift when the baby first had problems with Dr. Harkness? She didn't show up until 8 o'clock in the morning. Natural cause. Was it natural cause, or was it natural cause due to sewage exposure, the mom during time of delivery? Again, is this a baby D that happened months after baby D? This was months after baby D. You think they would have learned their lesson. Needed resusc after birth, bagging, needed ET tube in. January 7th, reintubated 2 o'clock. That was Dr. Harkness. January 8th, porcolor, pulled back tube. Again, why did he do it correctly? A little possible infection, a profound desat at 9 o'clock, an x-ray at 10 o'clock, cardiac arrest at 2 o'clock, and January 8th, pneumonia. Again, I would love to know if this is baby D part 2, but this is the twin version. I'll let you make up your own mind on this one. Bye-bye.